Hey, it's Dr. Troy here, Vancouver, Washington chiropractor. Today I want to talk about herniated discs, disc bulges, or protrusions in the disc. These are words you might see if you do a Google search or talk to doctors. They say, hey, you have a disc bulge, you have a disc herniation. Now, in the textbook, The Medical War on Chiropractic, it says 73% of non-symptomatic patients who had no symptoms of neck or back pain, 73% of them had disc bulges or protrusions that were found on an MRI. So that necessarily doesn't mean that a disc bulge or a disc protrusion could cause pain, but there are many times when it does. So here's what the research is showing. Dr. Mark Studin just did a published study on the benefits of chiropractic for disc bulge, disc herniation, disc protrusion. And one of the things I found very interesting is the fact that many of the mainstream media overlook the biomechanical factors of the spine, meaning how are the joints moving within gravity or without gravity? How are the muscles firing? They classically will take an MRI. I had somebody who chatted with me, and we'll put up her MRI here. You'll see right in the middle of her neck, around C5, C6, there is a bulge that's pushing into the spinal cord. So this patient has a disc bulge, disc protrusion. She went to her primary care physician. They ordered an MRI. That's what you're seeing here. The primary care doctor said, hey, this is outside of my scope, and she got referred out. Now, she got referred to a neurosurgeon. Her symptomatology was she was having right arm pain. And so the doctor said, you need to do surgery immediately. And so, unfortunately, in her case, she did. And what concerns me in this published study by Dr. Studin says that patients should have alternative care first, meaning chiropractic or physical therapy or some sort of non-invasive surgical procedure prior to having surgery. So this lady just went straight to surgery, and I'll show you the after effects of the surgery. You can look here. You can see there's even a more extrusion into the spinal cord. You can see the dark mass. This was actually an artificial disc that was put in her neck. The patient woke up out of the hospital. She said, hey, my right arm feels better. But after the pain meds wore off and the swelling went down, her right arm pain returned, and now she has left arm pain, and she has chronic neck pain. She can't drive in a vehicle very long. The bumping and bouncing really exacerbated. It's been 3 months, and she asked me, hey, Dr. Troy, what do you think? And I said, well, I can't do anything about the surgery, but maybe we should have tried conservative care first. Now, that's my mission is, hey, let's do conservative care first. If that doesn't work, then let's think about the surgery. But in many of these cases, Dr. Studin says that over 95% of the patients who went to a chiropractor within 3 months had significant improvement. Did you hear that? 95% improvement in 3 months. Now, it happens pretty quick. The first 2 weeks, patients were reporting 81% improvement if they had a disc bulge or a disc herniation with chiropractic care. And at the end of a month, it was 85%. So the results are going to happen pretty quick. Within the first 2 to 4 weeks, we're going to know if we're going to get this thing better. And that is definitely well worth checking out chiropractic to see if we can help you. Also, Dr. Studin pointed out that only 40% of patients who sought surgery got any type of relief. And he also mentioned that over 60% of the patients that went to the chiropractors were getting the relief they were looking for. So pretty amazing stats if you look at it. So my mission is, let's try conservative care first, and then, hey, if that doesn't work, let's do a neurological consult. It doesn't hurt to get the MRI. Let's take a look at it. Let's see if chiropractic's right for you. If you have these issues, they can be severe. It might require some intensive work up front, but you don't have to come forever to determine if chiropractic's right for you. So if you have these problems, know somebody suffering, schedule a consultation. Be happy to take a look. Been doing this for over 24 years, helping people get back on track with their health. It's Dr. Troy in Vancouver, Washington, 360-260-6903. That's my number if you want to schedule a consultation to see if natural chiropractic care is right for you.